2 for the Show Me Don't Tell Me quiz, and it's going to be over the bones and markings of the arm, wrist, and hand. So we'll start with the bone of the upper arm. This is the humerus, and first of all, this is the right humerus, and we know this because this is the head of the humerus, and the deep depression back here is called the Coronoid Fossa. This is the back, makes the elbow joint with the ulna, fits inside there making the elbow. So this has to be to the posterior. So if we know this is facing backwards and this is the head of the humerus, making it has to face medial towards your body, your shoulder, then this has to be a right arm. So again, we have right. So head of the humerus, and then there are 2 tubercles. The large one in the front is called the greater tubercle, and the smaller one here is called the lesser tubercle. Now we move down to the complicated end down here, and we have a few different structures that we want to look at. First is this little fossa right here that is called the coronoid fossa, and it accepts the coronoid process of the ulna when you bend your elbow. The large bump over here would be the medial epicondyle. The articulating surface of the bottom of the humerus is called the trochlea. You may remember from the test the pulley-like surface, that's the trochlea. And then this articular surface that works with the radius, the head of the radius, is called the capitulum. And then again on the back we have the Coronoid Fossa right there. And on this side would be the lateral epicondyle, okay? And that should take care of the humerus. So we move to the ulna, small bone in the forearm. The ulna is the bone that will make the elbow joint. So we have this large hook is the Coronoid process, again because it fits perfectly in the Coronoid fossa on the humerus. This curved crescent moon shaped articular surface is known as the semilunar for crescent moon, semilunar or trochlear notch, and it articulates with the trochlea of the humerus. And the coronoid fossa accepts the coronoid process. Coronoid fossa of the humerus is where the coronoid process of the ulna will fit when you bend your elbow. So again, we go coronoid process, Coronoid process, and then the semilunar or trochlear notch, which is right here. And down the end, this little point on the distal end would be the styloid process of the ulna. We go to the radius. The rounded disc top is the head of the radius. This large protuberance right here would be the radial tuberosity. And then down at the bottom on the opposite side of the wrist, this little point is the styloid process of the radius. So when you look at the bones at the wrist, this was something we talked about earlier. The bone that is wide at the wrist is the radius, and the bone that is skinny at the wrist is the ulna. And again, the ulna makes the hinge joint for the elbow. The head of the radius would be a pivoting joint because it will radiate around the ulna when you rotate your wrist. Okay? Speaking of the wrist, let's go ahead and go to the wrist. Okay, these are the 8 carpals, and they do have their own particular name. Hopefully we'll be able to see from this camera angle, but the way we will identify these is we will start here at the base of the thumb. We'll work our way across. So this large bone here, one of the larger of the carpals, this would be the scaphoid. And if we work from here over, going towards the little finger, so here's the thumb, this is scaphoid. The one next to it would be lunate. The one next to it is called the triquetrium. And if we go underneath, very small little bone right here on the end, attached to the triquetrium is a little bone called the pisiform. So we come all the way back across, and we look at the bone that makes the saddle joint with the thumb. This carpal here would be the trapezium. It's the one that rhymes with thumb. So you go trapezium, trapezoid, So trapezium articulates with the thumb, so those rhyme. Trapezoid, and then it's capitate, and then the last one over here is hamate. And the way we remember hamate is it has the little finger and the ring finger articulate with the hamate. And also, if you look on the underside of the wrist, next to the pisiform, the hamate has a rather large process that sticks out there. So again, if we work our way backwards, it goes hamate, capitate, trapezoid, trapezium, pisiform, triquetrium, lunate, and scaphoid. And those are the bones of the wrist. And then the bones in the hands would be the metacarpals, and the bones of the fingers, of course, would be the phalanges. Okay? So hopefully that will help you study those skeletal structures. And stay tuned, because next we will go over the bones in quiz 3.